Every health professional is familiar with the concept of patient or person-centred care. Part of delivering patient-centred care is about having good communication between patients and providers. This can be difficult for various reasons. Lots of patients have some kind of communication difficulty, such as a hearing impairment, or they might speak a different language to that of the treating healthcare team. These patients are particularly vulnerable in healthcare settings. Patients with communication disability are 3 times more likely to experience an adverse event in hospital. They're more likely to be dissatisfied with the healthcare they receive, and they are at higher risk of falls in hospital. This is not a small group of patients. A study by O'Halloran et al. Looked at the number of patients in acute stroke units with communication difficulties. They found 55% of patients had difficulty communicating their healthcare needs. Aphasia is one communication disability. People with aphasia and their family members say they are excluded from healthcare decisions. They say they don't receive adequate information to make healthcare decisions, and that there's a lack of opportunity to be involved in decision making. They also experience inappropriate discharge from hospital. We don't know much about what health professionals think about communicating with people with aphasia. Physiotherapists, occupational therapists, nurses and dietitians did not necessarily choose to work with patients with aphasia, but in stroke services, patients with aphasia make up 1/3 of the patient population. We ran focus groups with multidisciplinary stroke teams in acute and subacute stroke settings. This included nurses, nurse unit managers, physiotherapists, occupational therapists, speech pathologists, dietitians and a translator. We asked the multidisciplinary stroke teams to tell us about their experience working with patients with aphasia. What goes through their mind when a patient with aphasia approaches them on the ward? We found 5 themes in what the multidisciplinary stroke team told us. Health professionals say that communicating with patients with aphasia is a mostly negative experience. Staff are juggling a lot. They worry that talking with patients with aphasia is going to take too much time. As a result, they dread talking with patients with aphasia, and when they have unsuccessful conversations, it leaves staff feeling guilty, frustrated and helpless. Health professionals are not always sure how to help patients with aphasia. They told us they don't always have the training to talk with patients with aphasia, or if they do have the training, they lack confidence to use the strategies taught in training, or sometimes they simply forget to adapt their communication with these patients. Because of this, health professionals limit their conversations with patients with aphasia. They stick to safe topics, such as their own specific discipline, or talking about the patient's basic needs. Sometimes they pretend to understand the patient with aphasia because that's just quicker. And at other times they talk with the family member rather than directly to the patient. But health professionals told us they want to know how to help. They want to do a good job for their patients. They support each other by swapping tips on how to communicate with specific patients with aphasia. They told us that successful conversations do happen with patients with aphasia. These conversations have a positive effect on both the patient and the health professional. They told us that being able to communicate with a patient with aphasia means that the patient will be more motivated and engaged in therapy. Good communication means rehabilitation is more effective. So this is what we learned from talking with the multidisciplinary stroke teams. In a busy, under-resourced healthcare system, aphasia disrupts productivity and efficiency. This is challenging for staff who are trying to balance a patient's needs with the demands of the rest of the ward and their caseload. Health professionals are trying to be efficient and deliver high-quality service, but the system lacks the resources and the culture of prioritising adapting to the communication needs of patients. We also learned that aphasia challenges the idea of patient-centred care. Standard therapy activities such as setting therapy goals or checking if a patient has understood your instructions, all of these activities can take longer when the patient has aphasia. But extra time is not available for these patients. This impacts on every aspect of putting the patient at the centre of their own health care. In terms of how we can change this situation, we need to look at things the multidisciplinary team can do and things that the hospital management team can do. For health professionals, it seems that attending a one-off training session about aphasia is not enough. It would be better to have a longer-term approach to skilling up in communication, including lots of opportunities for on-the-job learning and shadowing others. If we're really serious about changing the healthcare experience and outcomes for patients with aphasia, we need some creative solutions. Hospitals need to embed supporting different patient communication needs in their ward culture and in KPIs. In its current state, the healthcare system is sending powerful messages of exclusion to patients with a communication disability such as aphasia.